If you do not understand each step of dental implantation, you can lose time, money, and sometimes even bone without realizing it until it is too late. Most failures do not happen because your body is bad. They happen because the plan was weak or one key step was rushed. Watch to the end, because the difference between an implant that lasts many years and an implant that must be removed can come down to a few simple details. Picture this. You lose a tooth, or it breaks, or it keeps getting infected, and someone tells you we can place an implant. In your mind, it becomes one event, like putting in a screw and done. But implantation is a journey, not a single act. And because it is a journey, you deserve to know what happens, step by step, in the right order. We will keep it clear and simple. First visit. Diagnosis, planning. Implant placement. Healing and bone integration. Then the final tooth, the crown. At every stage, I will tell you three things: what must be checked, what you may feel, and the common mistakes that ruin results. The first visit is not just a quick look. It is the moment where success is decided, even if you do not feel it yet. The dentist must understand why the tooth was lost. Decay, a crack, infection at the root, gum disease, trauma, and old failed treatment. Sometimes more than one cause. If the cause is not addressed, you can place an implant into the same problem, and the problem returns. Then your whole mouth is evaluated, not only the gap. Do your gums bleed easily? Is there heavy tartar? Are other teeth loose? Do you clench or grind at night? Is your bite balanced, or do you hit hard on one side? This matters because an implant is not a natural tooth. A natural tooth has a ligament that acts like a shock absorber. An implant is more direct. If the bite is wrong, the implant takes the load. Your general health is also part of the plan. Not to judge you, but to protect you. Smoking, poorly controlled diabetes, healing problems, certain medications, high stress, sleep apnea, grinding, anything that increases inflammation or slows healing. A good plan is not a standard plan. A good plan is a plan that fits you. Now, imaging. Remember this. Implantation without the right imaging is like driving at night without headlights. A simple X-ray can help, but proper planning often needs a three-dimensional view. Not to make it expensive, but to avoid surprises. Where the nerve is. Where the sinus is. How much bone height you have. How much bone width you have. And what the bone quality is like. Thin, fragile bone behaves very differently from dense, thick bone. At this stage, a key decision is made. Can the implant be placed right away, or must the area be prepared first? Sometimes the tooth must be removed, the infection cleaned, and the area allowed to heal. Sometimes removal and implant placement can happen the same day. Sometimes bone must be added, either before placement or during placement. In the upper jaw, if bone is low under the sinus area may need to be lifted to create space. These steps are common, but they change timelines, sensations, and cost. You should hear them clearly in your plan. Now, planning. This is the heart of implantation, and it is also the part you cannot see. A good implant is not placed where there is simply bone. A good implant is placed where the future tooth must be. Tooth first. Implant second. That means the dentist plans the final crown position. The angle, the width, the look if it is in the front, the shape of the gum, and also the long-term cleaning access. Can you clean between it and the next tooth? Will food trap? Will you be able to floss or use small brushes? This is also where the temporary solution is planned. What will you have during healing? Will there be a gap, a removable temporary tooth, a fixed temporary tooth? Temporary does not mean unimportant. A bad temporary can press on the gum, irritate the area, or change your bite for months. That can damage the healing environment. A good plan answers simple questions without vague language. How many visits, roughly? How long between steps? What are the main risks in your case? What could change the plan during treatment? Who does what? The surgeon, the restoring dentist, the lab. What is included and what is not included? Clear plans create calm. Vague plans create problems. Now, the implant placement day. Many people fear pain. In most cases, the procedure is done with local anesthesia, like routine dental care. and you should not feel pain during the placement. You may feel pressure, vibration, and hear sounds, and that can feel intense, but it should not be painful. If you feel pain during the procedure, it is not normal, and you should not be told to just endure. More anesthesia can be given. The approach can be adjusted. Precision should never require suffering. On the day, the mouth should be as clean as possible, and the gums should be calm. The plan should be ready. The gum is opened, the bone is prepared, and the implant is placed. The goal is not speed. The goal is stability and correct positioning. The area is closed or a small healing piece is placed depending on the method. Sometimes a temporary tooth is added the same day, but only if conditions are truly right. A classic mistake is rushing because you want to leave with a tooth, even when the bone is not ready for load. What do you feel afterward? Most often you feel soreness, swelling, sometimes bruising, and tenderness when chewing. You may feel tired. Usually the first 2 days are the most uncomfortable, then it improves. What should worry you is not normal discomfort. What should worry you is worsening, pain that increases instead of decreases. A bad smell that persists, pus, fever, numbness that does not return to normal. Difficulty opening the mouth that gets worse. In those cases you call. You do not wait. There is one simple rule that protects an implant more than any fancy product. During healing, you protect the area. You do not chew on it. You do not pull your lip and stare at it again and again. You follow the hygiene instructions, not too aggressive, not neglected, and you do not smoke, or you reduce it strongly because smoking increases complications, slows healing, and increases inflammation around the implant. If you think I have smoked for years so it will be fine, remember this. Implants do not tolerate chronic inflammation. They can look fine for a while, then fail later. Now we reach the most deceptive phase. Waiting. The implant is placed and you hear we wait. Many people think that waiting is wasted time. It is not. It is the most important part. The implant must integrate with bone. Bone must grow and lock onto the implant surface. This takes time, often several months, sometimes more, sometimes less, depending on the area, the bone, your health, and whether bone was added. The trap is that you can feel good quickly. The swelling goes down, the pain fades, you want to eat normally, but feeling normal does not mean the implant is ready for full chewing force. A common mistake is chewing hard too early on the implant side, especially if you have a temporary tooth that makes you feel safe. That early load can disturb bone integration. You may not notice it immediately. The problem can appear later when the implant feels sensitive, the gum gets inflamed, or the bone level drops. This is why follow-up visits matter. Good care is not come back in a few months, and we will see. Good care checks the gum health, hygiene, the temporary tooth, and any early inflammation. Sometimes small adjustments prevent big problems. Because an implant is not only metal, it is a system. Bone, gum, bite, hygiene, habits, and follow-up. Then there is a step that looks minor but matters a lot. Connecting the implant to the future tooth. Depending on the method, there may be a small visit to uncover the implant and place a healing piece that shapes the gum. This often is not heavy, but it influences gum contour and cleaning access. In the front area, gum shape is everything. An implant can be stable, but if the gum recedes or the crown looks too long, you may not be happy. Next is the impression or the digital scan for the crown. The goal is simple. A crown that fits perfectly supports healthy gums and has a correct bite. If it is too high, you will feel it hits first, and the implant gets overload. If it is too low, you chew elsewhere and overload other teeth. If the contact between teeth is too tight, floss cannot pass, plaque builds up, inflammation starts. If it is too loose, food packs, and daily life becomes frustrating. Now the crown choice. The key is durability, a natural look when needed, and a design that fits your mouth. Some people have strong biting forces, some have thin gums, some show a lot of teeth when they smile. There is also the way the crown is attached. The important point for you is not the technical label. The important point is control. It should be cleanable. It should be checkable. And if a problem happens, the dentist should be able to manage it properly. Poor attachment choices or leftover cement under the gum can trigger chronic inflammation. That is not a small detail, it is a real risk factor. The day you receive the final tooth can feel like a victory. You feel you got something back, but that moment can hide the main truth. Long-term success starts after the crown is placed. Implants can last a long time, but they need correct hygiene and regular checks. Not complicated, but consistent, and sometimes different from how people treat their natural teeth. An implant does not get cavities, but the tissues around it can get inflamed, and inflammation around an implant can lead to bone loss around the implant. When bone goes down, it is not always easy to rebuild. That is why prevention around implants is so important. After the crown, you need good routines. A soft brush with correct technique. Cleaning between teeth, not just quick brushing. In many cases, small interdental brushes are useful if they fit your spaces. Sometimes special floss helps. Sometimes a water flosser can be a helpful extra. And professional cleanings with tools suitable for implants matter. This is not selling visits. It is protecting your investment. Now, risks without fear, but with honesty. An implant can fail to integrate. It happens, sometimes due to infection, sometimes due to low stability, sometimes due to smoking, inflammation, or overload. There can also be aesthetic issues, especially in the front, like gum recession or uneven gum lines. And if planning is poor, there can be anatomical problems in the upper jaw near the sinus or in the lower jaw near nerves. These issues are rare when planning is solid. That is exactly why planning must be solid. Now, the common mistakes that cost the most. The first mistake is choosing only by price without comparing the actual plan. Two offers can look similar, but one includes proper imaging, detailed planning, guided placement, follow-up, and a well-designed crown, while the other is simply we place an implant and then we see. That later we see is where trouble often begins. The second mistake is ignoring gum disease before implantation. If your gums bleed, if you have heavy tartar, if you have active gum problems, placing an implant without stabilizing the gums is a major risk. Inflammation loves implants. The third mistake is ignoring the bite. Many people focus on pain and appearance, but bite is critical. A crown that is too high on an implant is very common. If you feel you touch first on that tooth, if you feel a click, if you avoid chewing there, it should be adjusted quickly, not weeks later. The fourth mistake is demanding a fixed tooth immediately when your case does not allow it. Sometimes immediate temporary teeth are possible, but not always. It depends on bone, stability, location, bite forces, and habits. A serious dentist sometimes says no to protect your outcome. The fifth mistake is breaking the healing rules because you feel better. Internal healing continues long after discomfort fades. The body may feel fine while bone integration is still fragile. The sixth mistake is believing an implant is unbreakable. People think it is metal, so I am safe. Then hygiene becomes lazy. Then gums start to bleed around the implant. A bad taste appears, slight swelling starts. People wait. And while they wait, bone can be lost. So how do you know your treatment plan is truly good? Use a simple checklist in your mind. A good plan starts with a clear diagnosis, not just we place an implant, but an explanation of bone, gum health, the reason the tooth was lost, and the specific challenges in your mouth. If you do not hear this, ask, what do you see on the scan? Do I have enough bone height and width? Are my gums stable? Do I grind? Is my bite balanced? The answers should be simple and consistent. A good plan gives a realistic timeline. Not a perfect exact date, but a logical range. If someone promises a final crown very fast without explaining why it is safe in your case, be careful. If someone tells you it will take very long without explaining why, ask what justifies it. A good plan is individualized, not automatic. A good plan discusses alternatives. Sometimes a bridge, sometimes a removable option, sometimes gum treatment first, sometimes orthodontics before implants, sometimes waiting. If you are pushed into only one option with no discussion, you deserve an explanation. A good plan explains the main risks and what is done to reduce them. Not just a risk exists, please sign. But in your case, these are the weak points, and this is how we manage them. If bone is limited, bone rebuilding is discussed. If aesthetics matter, gum management is discussed. If you grind, protection at night is discussed. If you smoke, a realistic reduction strategy is discussed. A good plan explains the temporary phase, how you will live between surgery and the final crown, what you will wear if anything, how visible it is, what you can eat, and how the implant is protected during that time. Many disappointments come from poor temporary planning. A good plan includes follow-up. When healing is checked, what to do if inflammation appears, what maintenance looks like long-term. If you are given the impression that after the crown it is finished, that is not good education. And a good plan allows questions without making you feel small, because you are not buying an object. You are choosing a long-term medical project. Here is a simple test. After the consultation, can you explain the steps back in your own words? Can you say what happens first, what happens next, how long each phase takes, and what you must watch for? If you leave thinking I do not really know what we will do and why, but the dentist sounded confident, that is a warning sign. If you leave thinking I understand the path, I know what we check, I know what I should do, and I know what signs to watch, you are much closer to success. If you remember one sentence, remember this. Implantation is not a single procedure, it is a strategy. The metal is only one part. The real result comes from bone, gums, bite, hygiene, and follow-up working together. So tell me honestly, before you say yes to an implant plan, can you describe the steps, the timeline, and the key risks in 1 minute? Or are you still moving forward in the dark and hoping it will all be fine?